Les porte-parole
Spokespeople in the following order are main epidemiologist for COVID-19 with public health, Mr. Mathieu Chalifou, Chief Medical Officer of Health, Dr. Jennifer Russell, Executive Director for Vitalité, Dr. France Desrosiers, and the interim President Director for Horizon, Dr. John Dornan. Mr. Chalifou.
Tous et à toutes. Good afternoon, everyone.
Bon après-midi toutes et toutes.
En face à sa plus importante vague de COVID-19 à ce jour, la vague Omicron. On m'a demandé aujourd'hui de vous fournir des précisions sur ce à quoi pourrait ressembler cette vague et sur ses répercussions possibles. New Brunswick is currently experiencing
Le Nouveau-Brunswick connaît actuellement sa plus grande épidémie de COVID-19 à ce jour, la vague Omicron. Aujourd'hui, on m'a demandé de vous fournir quelques détails sur ce à quoi pourrait ressembler cette épidémie Omicron et quels pourraient être ses impacts.
the Omicron variant is highly transmissible, and though milder than the Delta variant, it is by no means mild. For every 1,000 cases under Delta, we would have expected 60 admissions. With Omicron, we now expect 10. While better, this is still enough to put our health system at risk due to the sheer volume of cases. Cette diapositive
This slide shows the number of cases per day since September 1st, 2021. In October, we faced the most important wave so far, registering 140 cases in one day at the highest point.
on this slide are number of daily recorded cases since September 1st, 2021. In October, we went through what was, at the time, our worst wave to date, recording 140 cases in a single day at our peak. When accounting for individuals registering their POCT results, we are now recording well over 1,000 cases per day, and we know that this is underreported. This is above and beyond our capacity to continue testing and recording accurately. Yet we're starting to observe this affecting our total number of hospitalizations. Today, we report 88 active hospitalizations, a new high for the province. This experience is not unique to New Brunswick. In fact, in many ways, this is the first truly national experience of COVID-19 we have had since the beginning of the pandemic. Des nombreux cas de cas sont présents.
Many cases are now pointed out in each territory and province, and the number of hospitalizations is increasing in certain provinces, reaching rates never seen up to date.
Every single province and territory is now seeing record case counts and are experiencing a rise in hospitalizations, with some provinces reaching highs never before seen. On the screen, you now see the 7-day average for active hospitalizations shown for every 100,000 people. This allows us to demonstrate how New Brunswick directly compares to other provinces. We can see that on January 8th, other provinces such as Ontario and Quebec were at levels 2 to 3 times higher than where we were at that point in time. This provides a stark picture of where we are likely heading. You will now see on your screen, on the left, our projected number of cases over the coming weeks, and on the right, the corresponding increase in hospitalizations over that same time period. These models were built in collaboration with our colleagues at the University of New Brunswick and are based on our current situation. Comme vous pouvez le voir,
As you can see, if the tendency continues, we'll reach a higher number of cases at the end of January, beginning of February. There would be close to 5,500 new cases per day and close to 220 active hospitalizations.
If these trends hold, we expect to reach our peak towards the end of January, early February. This would represent close to 5,500 cases daily and nearly 220 active hospitalizations. As trends decrease, we expect to be where we are today in about 5 to 6 weeks' time. In terms of cases, isolation requirements will undoubtedly impact our healthcare capacity. We will be hit on both ends. However, the implications are broader. At our peak weeks, we can expect over 5,000 New Brunswickers developing the disease daily. Over a 5-day period, this would be about 25,000 individuals. Assuming 2.3 individuals per household, this could mean over 7%, or approximately 55,000 people, isolating at any given moment. When you factor in longer isolation periods, for example, for unvaccinated children, this number will likely be higher. This will impact not only our healthcare system, but also other critical services, such as fire departments, police departments, power services, and so on and so forth. It will also impact large and smaller businesses, as workers either require sick time or isolation time. We are in this together, and there is something that we can do. You can now see our projections should we note a reduction in our contact rate by Friday, January 14th. On your left, you will see the projected impacts on cases, and on your right, the projected impacts on hospitalizations. The yellow line shows us our expected path forward. The pink line shows what we would expect to see if contact rates are reduced by 10%, and the blue line shows the same, but with a reduction of 20% in our contact rate instead. We all have to do our part in reducing the number of contacts that we have.
If we can succeed in reducing our contacts by seeing fewer people, by practicing distances, and by wearing well-adjusted masks inside, our highest point could then be cut by 2/3 of what will happen if no changes in the public behavior.
Able to reduce our contacts through either seeing fewer people, distancing appropriately, or wearing well-fitted masks inside, then our peak may be cut by 1/3 of what would happen without any changes in public behavior. As I said earlier, Omicron is much more contagious than the other variants we have seen. It is everywhere in this province, and we need to assume that everyone we come in contact with could have it. The next few weeks will be intense, but they will not last forever. We will get through this. My message to New Brunswickers today is this: the best way to prevent COVID-19 right now is to reduce your contacts. This small action will protect your family, reduce strain on the healthcare system, and protect our economy. Mon message à la population.
My message for the population of New Brunswick is the best way to prevent COVID-19 at the present time consists in reducing your contacts. This simple action will protect your families, reduce pressure on the health system, and is going to protect our economy.
The severity of this wave of Omicron is in your hands to control. Thank you. Merci.
Merci, Mathieu.
Thank you, Mathieu. Good afternoon. Good afternoon to all.
Everyone. Depuis plusieurs...
For many months, we have been repeating that we have to learn to live with COVID-19. For many amongst you, this statement has taken a new sense, a meaning, and more immediate these last few days. Today, each New Brunswick citizen must live with COVID-19, not only indirectly because of the confirmed cases in the province or our communities, but for many of us, there are cases in our households and in our families.
We have been talking about living with COVID-19. For many of you, this phrase has taken on a new and more immediate meaning in recent days. Today, every New Brunswicker is living with COVID-19, not just indirectly because there are confirmed cases in our province or community, but for many of us directly in our homes and with our families. The Omicron variant has significantly altered the course of this pandemic. Because it is more contagious and incubates more quickly than earlier strains of COVID-19, we are seeing a rapid spread of the virus in every corner of our province. We are experiencing record numbers of confirmed infections and more people hospitalized for COVID-19 than any time since the pandemic began 2 years ago. This has brought COVID-19 into the lives of every New Brunswicker in a way that most of us have not experienced before. In some ways, this has been the biggest change brought on by the Omicron variant.
During the preceding waves, you didn't necessarily know a person who had contracted COVID-19. At the present time, the virus is present everywhere. These situations are not going to last eternally.
Waves, you might not have personally known a person who contracted COVID-19. Now it is everywhere around us, and this won't last forever. This is a phase of the pandemic which we will get through as we have gotten through all the stages that preceded it. This storm will pass, but we are in for several weeks of very bad weather. And the gathering storm could include record hospitalizations at the same time as high numbers of healthcare workers are in quarantine because they are COVID-19 positive. Since Christmas Eve, staff in the Department of Health, the regional health authorities, and EMANB have been working tirelessly to address this situation. They have agreed to reorganize services inside facilities, then reach to nearby hospitals, and then to support each other provincially as necessary. And I just want to commend the work that all of these people are doing within these organizations, as well as the frontline staff, who are understandably exhausted. This will make sure that critical life-saving services are delivered to New Brunswickers, and this is key. In the weeks ahead, we will need to look after ourselves, care for one another, and protect those who are tirelessly working to keep us all healthy and safe. Given the rapid spread of the Omicron variant, it is very likely that most of you will have direct experience with COVID-19. Vous pourriez vous-même contracter le virus.
You can contract the virus yourself to take care of your families who has contracted it or to support members of your family, neighbors, or friends who are sick after having contracted the virus. We must all be prepared for the repercussions of COVID-19. First, we have to establish a plan.
Be required to care for an infected family member or be called upon to support family, neighbors, or friends who are ill due to the virus. We all need to be prepared for COVID-19, and that begins with making a plan. Please make sure that you have the right supplies on hand. You will be needing these to care for yourself and others, including things like tissues, medications for pain relief, a thermometer, easy-to-prepare meals, soups, Gatorade, Pedialyte for hydration. Faites le plein de fournitures.
Make sure you have all the necessary things that you need to take care of yourselves and others, such as the thermometer and easily prepared meals like soups and other things as well, and liquids like a Gatorade or Pedialyte.
Infection. Be aware of school and workplace policies for responding to this illness. Determine who you can count on for assistance when you need it most, and make sure these people know that they can count on you too. Determine
who can help you when you have the greatest need. Make sure as well that others know that they can count on you and they can count on you as well.
Pandemic. Wear a mask, maintain physical distance from others, wash your hands regularly and thoroughly, and limit your contacts as much as possible. And most important of all, get vaccinated. Make sure you have your first 2 shots and get a booster shot as soon as you are eligible. And really, of the 88% people hospitalized today in New Brunswick, 24% of them have had their booster, so it's not that it eliminates the risk, but it diminishes it greatly, while 76% of the hospitalized individuals are either unvaccinated, partially vaccinated, or it's been 6 months since their last dose. As of yesterday, all New Brunswickers over the age of 18 can receive a booster shot if more than 5 months has passed since their second dose of the COVID-19 vaccine. Make sure your children are vaccinated. The COVID-19 vaccine is safe and effective. It is the best way to offer our kids the stability they need and get them back to school and the activities they love. These layers of protection will help guard against the worst effects of the COVID-19 virus, including severe illness, hospitalization, and death. By being prepared ahead of time, you will be much better positioned to look after yourselves and your loved ones if you become infected. If you and your family are vaccinated and boosted, your experience of COVID-19 may be fairly mild. And I'm going to qualify this term mild. When we are talking about mild, we're talking about the fact that you most likely will not need hospitalization. But that doesn't mean that your symptoms will be completely benign. Symptoms can range from fever, aches and pains, sore throat, and coughing, but they can be more severe, including fatigue and chills, shortness of breath, nausea, and dehydration. If you do contract COVID-19, rest and stay well hydrated. Non-prescription medications like Tylenol and ibuprofen can help with pain and fever relief. You may also want to use a humidifier or steam from a shower to ease cough or sore throat. The Omicron variant is highly contagious, and caring for someone with COVID-19 requires that you take steps to limit its spread within your household. And I have heard from my team, there's messages on the internet, but also I've heard the success stories of where somebody did successfully isolate within the home, and it really was around staying in one room, and that person wouldn't leave that room for any reason, and if they did, they would be wearing their mask. But so doing your best to separate from the infected person is the most important thing. They should sleep in a separate room and not participate in family meals or activities. They should use a separate bathroom if one is available. Wear a mask when leaving the room. They should not share personal items with others, such as utensils, food and drink, phones, TV remotes. And also in the situations where we heard that the virus did not get transmitted, people would bring the food to the person's room but not take any dishes out. They just left them there, and sometimes they would use disposable plates and utensils, etc. When you are caring for a person with COVID-19, please remember to wear a well-fitted mask when you are with the infected person. Medical masks like N95s are the best, but non-medical 3-layer masks can be used if they fit well and completely cover your mouth and nose with no gaps. Les masques médicaux, comme le masque N95.
Medical masks like N95 offers maximum protection, but non-medical masks with the 3 plies can also be worn if they're well adjusted and completely cover the nose and the mouth in very soon.
A mask when in close contact with caretakers and other family members, but again, avoiding contact is the best. They should be masked when they are in common areas, such as the kitchen, bathroom, or TV room of your home, but again, I don't recommend that they're in the same room at all. If you do have a separate bathroom for the infected person to use, there are steps you can take to limit the spread of infections, such as opening windows, closing the toilet lid before flushing, and regularly cleaning high-contact surfaces, such as door handles and faucets. Most cases, particularly among those who are fully vaccinated and have a booster dose at 5 months, should be able to recover at home. But there may be times when medical care is required. We encourage you to call your primary care provider or Telecare 811 for assistance first. If you receive a positive PCR test, you will receive a health check call to ensure you have access to community health services. This is why our more vulnerable 50 and older population are directed to get a PCR test when symptomatic, along with other priority groups, including healthcare workers, or those who live and work in long-term care facilities, homeless shelters, correctional facilities, people who are immunocompromised, pregnant, people who are identified as a priority by public health, and people who live in First Nations communities, and children under 2 are also eligible to receive a PCR test. We have pivoted our point-of-care testing programs to ensure the public and employers use them judiciously to identify positive cases and to protect individuals in their homes and workplaces. With rising cases, we will need to use our supplies to target those who are symptomatic. Cependant, des soins
However, medical care could be necessary, and dial 911 if you have any problems and you have those symptoms. A lot of important difficulties in breathing, pressures, and mental confusion, difficult in waking up.
Experience these symptoms: significant difficulty in breathing, chest pain or pressure, new onset of mental confusion, difficulty waking up. If an ambulance is required, be sure to tell the dispatcher that this is a case of COVID-19 so that paramedics are prepared to deal with your situation. If you are able to get yourself to a hospital, have your caregiver drive you. Don't take a bus or a taxi. Both the patient and driver should be masked and sit as far apart as possible. And please also consider having a plan for who will look after your children if you have COVID-19 and are unable to. As important as it is to know how to care for someone who has contracted COVID-19, it is just as vital to know how to take care of yourself. These are very stressful times for all of us, and it is not unusual to feel grief, sadness, and frustration about what is happening all around us. Especially if you are caring for others, you need to look after your own physical and mental health. Make sure that you eat healthy and well-balanced meals, get plenty of sleep, take regular breaks that provide an opportunity for diversion and relaxation. Exercise regularly outdoors in the fresh air whenever possible. Take your news from trusted sources and be conscientious and cautious of your use of social media. Above all, stay connected with friends and family. Call a friend or a loved one. Let them know that they are needed in your life and that they can depend on you as well. Now more than ever, we still need each other as we weather this storm. Le printemps sera bien.
Spring is soon going to be here, and better days are waiting for us. Deal with your own safety and take care of your loved ones so that we can all arrive together.
Days ahead. Keep yourself safe and look after those you love so that we can all get there together. Thank you very much. Merci.
Thank you very much. Good afternoon, everyone.
Je suis contente d'être
I'm happy to be with you today to present the situation report for Vitality Health Network. Like Mr. Chadifou and Dr. Russell mentioned, the fifth wave of this pandemic with the arrival of the Omicron variant is hitting New Brunswick rapidly and with an intensity that we've hadn't known since the beginning of this pandemic. I want to reassure the population that Vitality Health Network and all the interveners in the health system are working very closely together to go through this crisis. Both health networks have gone to the red alert level December 31st. Concretely, this means that many services and non-essential health care are reduced or interrupted temporarily. All our teams on the field are mobilized, and we're watching the evolution very closely. Our objective remains the same: maintain essential services for the people, in spite of high hospitalizations in COVID and the staff shortage that are to be foreseen because of the behavior of this variant. Our priority is to maintain essential services like emergency services, urgent surgeries, intensive care, and dialysis services, obstetrics, and oncology services, and dealing with patients having COVID-19. As of today, we have 42 patients of COVID-19 that are hospitalized in our establishments, of which 4 are in intensive care. The occupation rate for our hospitals is very high, that is 94%. One of the particularities of this fifth wave and the Omicron variant is its contagiousness, which makes that in spite of all the precautions taken, a great number of our workers in healthcare are affected and greater number risk being so over the next few weeks. The network has at the present time 142 health workers who had to be withdrawn from work because of a positive diagnostic for COVID-19. Based on the experience we've known since the beginning of the pandemic, mainly in the Campbellton and Edmundston regions, we have continuously tested and improved our pandemic plan. To face the Omicron behavior and the lack of staff, we have sequenced the 3 intensity levels, a plan in which we've identified different measures to take, always to ensure our essential services. We're now between the line between the light and moderate level, and some measures have already been put in place, like the return of our health workers who had close contacts, who had a positive diagnostic for COVID. These sequenced interventions can be done in the establishment, in the zone, or in cooperation with other zones when the situation requires it. Over the last outbreaks, it was possible to manage the situation through collaboration of everyone to put in place a series of measures such as limit the number of services, limit reasons for new admissions, always with the goal of preserving essential services allowed to re-affect the staff to other critical sectors, and to cooperate between the sectors of one hospital or with other hospitals in the zone or even other zones or with our colleague, the Horizon Health Network, when a certain level of capacity is reached. Faced with this situation, we have shared our learnings with all our partners who work all in cooperation in order to establish provincial approaches to face different scenarios of staff shortages, even if they're the most pessimistic. Parallelly, we're working on other fronts at the present time to reduce the occupation rate in the hospitals, to accelerate the placement of seniors in long-term care establishments, to improve access to primary health care so as to avoid hospitalizations and ensure mobility of our staff. And we always add to that our work for vaccination and checking the population. At the height of the crisis, the people in New Brunswick will have no doubt to get to work and to show once again a level of self-help and compassion like never before. The network must manage many warnings for exposures and outbreaks in many of these care units. Situation is really serious at the Edmundston Regional Hospital, where the network had to declare the hospital as an eruption, and the experience, according to the preceding waves, has prepared us to manage such situations in our hospitals. And we have shown, and we will still demonstrate, a great adaptability, and that's the case in Edmundston at the present time. I'd like to thank the people of the Northwest region for their cooperation and to ensure that everything is in place in their regional hospital to face this situation. There's a statistic that I'd like to share with you. It's very important. The 3rd vaccination dose offers protection that contributes to reduce hospitalizations up to 88%. Vaccination is still the master part in our struggle against COVID. I would ask you to get vaccinated as quickly as possible. Vitality Health Network continues to work with people in the province, its employees, and its doctors in order to win this battle. And we ask you to do your part, once again, by getting vaccinated, by respecting sanitary measures, by minimizing your contacts, and minimizing your visits to hospitals except for emergency care, of course. In conclusion, I'd like to point out the support of the Department of Health, as well as our partners, Horizon Health Network, Ambulance New Brunswick, Extramural, and the Department of Social Development. And the cooperation between all these players in the health system is exemplary and is going to allow us to go through this storm. I want to thank as well interveners in healthcare, that is the employees and the doctors of the network, for their commitment and their determination. I know that you are many to thank them and to recognize those. And thank you for encouraging them. They are doing extraordinary work. Thank you for your attention.
Good afternoon, everyone. I'm John Dornan. I'm the interim President and CEO of Horizon Health Network. We're not done with COVID yet by any stretch. You know, I have an optimism every day when we don't have 1,000 admissions that maybe this is not going to affect us. Maybe this is going to pass. And that's just inappropriate optimism. We are at the start of a very high tidal wave. It's creeping up now, but in the next 2-3 weeks, it's going to crash over us like no one's business. We have seen rises in cases in adjacent provinces, Ontario, Quebec. There's no reason to believe that we are not going to be affected in the same way. And to not be prepared for that would be irresponsible. We are near the 2-year mark, but the worst is yet to come, and it's not going to come over the next 6 months. It's going to come over the next few weeks. We're seeing a rapid increase in the infection rate in our communities, as is the case with Omicron, and that will translate statistically into admissions to our hospitals. I look at the daily stats, and I know that they are growing. The number of people that are coming into the Horizon and Vitalité hospitals continue to increase. And in normal circumstances, we might be able to tolerate that to some extent. Every day, we have 250 employees that are not able to turn up for reasons of, I'll say, vacation, illness, long-term disability. Today, we had 164 people not be able to turn up because they had COVID or COVID associations or connections. We can't work with that reduced staffing environment. As is the case, and as Dr. Desrosiers mentioned, we have to have plans. And we are beyond the first level of each of the plans that we have now. For example, when our staff are a COVID contact or a COVID positive case, in conventional times we would say stay home for 10 days, get a point of care test, and then come back in again. That's a conventional approach. In all of our hospitals, we are at a contingency approach, which means that after 5 days of home isolation, and you test negative, you can come into work. We are not encouraging you to stay home for 10 days. We're asking you to come back after 5 days. We have further phases in what we do if we are shorter staffed. And in some of our hospitals, some of our units currently, we are at a crisis level where we are asking people to come back even earlier than 5 days. You know, in the past, we would make plans for an outbreak area in 1 or 2 of our hospitals and 1 or 2 of our units. At the St. John Regional Hospital, we have outbreaks on 6 units currently. It would be inappropriate to say that we have more outbreak than non-outbreak units, but 6 is a large number, and these are not small units. To give an example, it's neurosurgery, obstetrics, internal medicine, family medicine, ALC units. These are the breadth of our hospital. In fact, we're at a point now where we're not able to contain all of our affected and close contact patients in 1 or 2 areas. We have to start to consider additional plans where we would look after people in split units where half the patients might be under isolation, the other half might not be COVID infected. So we are working along a phased approach. We're beyond the first phase. We're not at the last phase, but we are doing that in cooperation with government leadership and Vitalité. Another example of a phased approach is, you know, as we run short of staff, we gradually reduce the non-critical emergency services in each of our facilities. That's already started. And then we start to look at what folks from other areas could help us. Throughout Horizon, at some point, we will be welcoming staff from Vitalité if they have adequate staff. And we have reached out to people in our community that might have worked with us recently, ER nurses, ICU nurses, and I'm pleased that a plan has been evolved that would make it attractive for people to come back and help us out in a time of crisis. I did illustrate St. John Regional Hospital. Because of the number of outbreak areas, we don't have a facility that doesn't have some outbreak area. And when we have programs like the Heart Center, like neurosurgical centers, we can't simply close the door on such hospitals, so we do our best to keep them open, care for people appropriately, and separate where at all possible patients that don't have COVID. You know, we have 88 people in our hospital today with COVID. It's an alarming statistic that 35 of those people didn't come in with COVID. They came in with something else, a leg fracture, pneumonia, heart disease, and acquired COVID in our hospital. So if at all possible, if you find another way to deal with your medical symptoms that might not be urgent, but might be cared for by your family doctor, your nurse practitioner, pharmacist, virtual care, and we'll hear plans over the next few days about what that might look like. We know that seniors are affected by COVID more seriously than other people. A large fraction of our population is senior carers, and some of those people, we don't have the resources to send them home at this point in time. We are looking at doing that better in cooperation with social development, our social workers, our discharge planning, and so we're hopeful that that will give us some hope. You know, we have cut back on surgeries quite a bit. Currently, in Horizon, we have cancelled over 360 surgeries over these last few weeks. And these are surgeries that need to be done. We've used the term elective in the past. There's no elective surgery. These are surgeries that need to be done to reduce pain, improve mobility, improve health. And so we've had to postpone that, and we don't like to do that. We continue to provide emergency, life-saving surgeries, and as well surgeries for people that have cancer that cannot wait another 2 or 3 weeks. So we continue to do that and are hopeful of still providing the essential care that we want to give. You know, I hear the statistics about reducing contacts, and you know, if I had to give a message, it wouldn't be anything that I've reported to you thus far. It's the message what reducing contacts does. And we heard Mr. Chalifoux talk to us about if you could reduce your contacts by 30%, we might, I'll use an old term, flatten that curve in terms of the impact on all of our healthcare facilities. So I would strongly encourage people to do that. You know, I try to think about it in realistic terms. What if for the next 10 people I might be in contact with at a grocery store or other words, what if I cut that back by 3 people? And every time considered what people I needed to cut back. So I'd like to close it off now. Be very thankful for all the healthcare workers that we work with in Horizon, in Vitalité, in Amherst, New Brunswick, the extramural program, and our government colleagues. It's by working together as a team and a phased approach will we beat this pandemic. Thank you very much.
Merci beaucoup, Monsieur Chalifoux.
Thank you, Dr. Chalifoux.
Mr. Chalifoux, we'll now proceed with questions from members of the media. Each reporter will have 1 question and the right to pose their question in the official language of their choice. Nous allons maintenant procéder.
We'll now proceed to a question period with the media. You'll have questions. You can ask a question in the official language of your choice. Each reporter will have 1 question.
Of CTV.
Hi, folks. Are you able to hear me?
Yes, thank you.
Perfect. Thank you, Bruce. My question can be for Dr. Russell. Given the very grim outlook of what hospitalizations are likely to look like in the coming weeks, why is the province not implementing more lockdowns, more restrictions, and really getting behind them to try and get ahead of this current situation?
Thanks, Ailish. Lots of people asking that question these days. And we have triggers to have our discussions. We're definitely following the situation really, really closely, hour by hour on a daily basis. So there's no question that trying to balance the risks of what's happening right now in our healthcare system versus the consequences, unintended consequences, negative impacts of more restrictive measures at this time, again, has to be balanced in our discussions, which we are having actively. So right now, we're again, Mr. Chalifou presented all of the epidemiological projections, and so again, we're keeping that in mind. The briefing today is really about how to make sure that New Brunswickers understand the situation as it is today, what actions they can take personally, again, around keeping their close contacts low, getting vaccinated, getting boosted, etc. Those are really important things to keep in mind right now, and we will continue to monitor the situation extremely closely. Again, it's not a decision that would be taken lightly, but it's definitely something that we're monitoring very closely.
Thank you. We're now going to go to Vicky Hogarth with CHCO TV.
Thank you, Bruce. My question is likely for Dr. Chalifou. The projection for hospitalizations in the near future is obviously quite troubling, but when exactly are you projecting Omicron peaking in the province, and can we take any silver lining from this massive spike of infections? Will this combined with vaccines lead to some form of herd immunity, and could we expect to move from pandemic to endemic at some point this year?
Thank you very much for your question. So just to ensure that I understood correctly, the question is about if or when we can expect to peak in terms of hospitalizations?
In terms of also cases, and if there could be some kind of silver lining to take away from that perhaps this could be going from pandemic to endemic. Is there anything that good can come of this?
So what I can speak to is the models that would have been shown, and those are suggesting that we're in an upward swing for the next 2 to 3 weeks, peaking right towards the end of January, early February. And our expectation is that things would go down under our current measures and our current situation. Things would go down following that point in time.
Thank you, Ms. Hogarth. Sarah Derry.
Sarah Derry, Radio-Canada. Yes, my question is concerning people in hospitals for other, and they contracted the COVID in the hospitals, if I understand correctly. Would be 35 people at the present time. Can you confirm that? And maybe tell us if among these people, are they in intensive care for the disease, and what are the measures to avoid having people who will contract COVID at the hospital level? Thank you for the question. Maybe Dr. Dornan can add to the different possible scenarios for these 35 patients. I can speak for Vitality Health Network. Mainly, we have about 15 patients who have tested positive after being admitted to the hospital. It's fairly difficult to point out if the patient contracted the virus before coming to the hospital and came for another reason and became positive after admission, and as well if he contracted the virus during the admission at the hospital. So we'll have to remember that community transmission is everywhere in New Brunswick at the present time. One of the more safest places is in the hospital, where everybody is wearing protection at all times. It's not impossible to transmit COVID in a hospital environment. It has happened since the beginning of the pandemic. Now, in our intensive care at the present time, there are 3 patients who have tested positive for COVID and were admitted for other reasons than COVID, but those patients tested COVID at admission. So it's not a transmission in our hospitals. Our 15 positive admissions, and the 12 others are shared, and we cannot identify the cause for each of the patients.
Thank you very much for the question. Yes, I might have misled people. Some of the people that didn't come in for COVID reasons had COVID when they came in. And it's so severe, though, that we are now screening with testing all of our patients that are admitted, COVID or otherwise, because we know that some people have crept in for those reasons. Yes, we have currently 9 people in our ICU, 46 active admissions. And we would have liked to keep them on single COVID units, maybe even beefed up COVID units, but there are that many people now and projected that we have to start looking after people in other areas, but protecting them from non-COVID infected patients and staff. And we are really working harder to keep any nosocomial transmissions. I was in a lunchroom the other day. I had an opportunity to see activities happening in our heart center. And I went into the room to get a key. And I opened the door into the lunchroom, and I saw 4 nurses in the lunchroom, way more than 6 feet apart, all with masks on. I just taking the mask off to have a bite or a drink, and when they got up to go to a sink or something like that, the mask was back on again, and we're cleaning their areas. So, you know, we're doing all we can to reduce nosocomial transmission, infections amongst our staff, and generally when our staff are infected or exposed, it's something that's happened in the community, less so in the hospital.
Thank you, Doctor. Merci beaucoup à vous deux.
Thank you both. Simon Bellat, Acadie Nouvelle. Simon Bellat, Acadie Nouvelle. Yes, a question for the head epidemiologist. Finding the question a while ago is to find out if the Omicron variant, we can consider it's the last wave of the pandemic. That's what many experts and in public health as well. So is it a prediction that you would make?
Bonjour, Monsieur Delattre.
Bonjour, Monsieur Delattre. I'm not going to pronounce to say if it's the last wave of the pandemic. What I can say is that what we have, the models we have under present situation suggest a decrease following having reached a peak, if you want. But from there to say the virus continues to mutate and change, it's not the first, it's not the last curveball that we are sending you. So from now to say that it's the last wave, I can't do that. Cannot do that. The virus still has other things under their sleeves, up their sleeves rather. Thank you.
Hi, good afternoon. This is for Dr. Russell. Some parents are looking for a shorter interval between doses for their kids aged 5 to 11 to protect them and also make a possibly sooner, safer return to school possible. NACI recommends 8 weeks, but that's based on adult data. It authorized 3 weeks based on Pfizer clinical trials, and in some provinces, parents can choose the shorter interval. I'm wondering why not here?
Well, that's a great question, Jacques, and I've seen that in social media, and I probably have some of those questions in my inbox as well. We are spacing it out according to NACI, is my understanding, but again, there's many factors involved in how we roll that out at the same time that we're rolling out booster shots for other populations. So it's really a balance of resources, et cetera, and ramping up as much as we can to protect everyone at the same time. So I do hear what you're saying. There are drawbacks to reducing that interval, so in terms of longer term immunity. So again, it's a balance of what we need to do to protect our population as a whole right now.
Thank you. Alexandre Boudreau avec l'Acadie.
Alexandre Boudreau, Acadie Nouvelle. Can you hear me? Yes, we can. So I have a question on phase 3. It's that 100 active hospitalizations or 50 hospitalizations in intensive care. And that trigger, as a trigger, have they changed these triggers for phase 3 in present of the capacities for the health networks and number of workers who are in stoppage, who are not be able to work? At the present time, we have not changed the triggers, but we have to remember that the triggers are not the triggers to go to phase 3. They're triggers to have discussions, active discussions to make these decisions. It is something that we're discussing every day, practically, because we have the information as soon as the hospitals can give them to us at the Department of Health and Public Health. So we're able to obtain that information, and we're going to continue to watch very closely, and if necessary, to move to phase 3 That's what we recommend at that time. Thank you, Mr. Boudreau. Dr. Russell?
Savannah Odd with the Telegraph Journal.
Hi there, can you hear me?
Yes, thank you.
I'm wondering, Dr. Russell, if you could give some guidance to those trying to understand how exactly to cut down on contacts so it will be enough. I guess, should people stop going out in public except for groceries or essentials? Should we be sticking within our own household? Is study 10 still okay? What kind of advice would you give to people making those decisions?
The simple answer is, if you don't absolutely need to spend time with other people in any situation, then don't do it. So really try to keep it to the critical things that you need that are essential. Andre Picard actually just wrote an article in the Globe and Mail that really has a great way of framing your risks of contracting COVID in many different situations. So obviously the situation where you go to few places as possible, with as few people as possible, and don't entertain people in your home, etc., unless you absolutely need to for care of a loved one, etc. So whatever the bare minimum is that you can survive with at this time is probably the best. But we know that varies from person to person depending on their mental health status and their physical health status.
Thank you. Eloise Rodriguez avec
Radio-Canada. Yes, good afternoon. I'm looking at your projections for hospitalizations, and I'm wondering at what time does it risk to be too much for the health networks? I don't know if the Dr. Russell or others can answer that, but there are more than 80s. Then costing 200 seems quite difficult to manage. Are you afraid that the networks are going to crack open? All the plans that we put in place are sequential plans according to the severity of the situation. We never consider just one factor to deem if the situation is moderate or severe in the plans that are coming up. It's always many factors. The number of hospitalizations is one of them. Number of hospitalizations in intensive care is another one. The percentage of absenteeism is another one. And we have a few others that are not as important, not as major. So are we afraid? All the workers in health are in an anxious mode, anxiety mode right now, but we're ready. What we can say is we have a pandemic plan in place. We've tested it many times over. We know that it works, and we improved our plan, and we have improved continuously, and we have all types of solutions in sequence that are aligned to face the crisis in human resources that is going to be inevitable up until the more pessimistic scenarios. It's not only about the number of hospitalizations, and I'd simply like to say that the number of hospitalizations in intensive care and proportion is lower than with the Delta variant. So we're accommodating behaviors of the variant, and what we expect is more patients in a COVID unit, but not necessarily in intensive care. Thank you very much.
See.
Yes, thank you. Can you please tell us how many hospital beds and ICU beds Horizon and Vitalité each have, and how many ventilators the province has, please?
Thank you very much for the question. Paperwork so that I can give an accurate number of ICU beds. It's close to 100 in Horizon, but it's a fluid number. We have other areas that we can use for ICU purposes, for example, a post-operative care area. We have more ventilators than we have beds, and so we have a capacity to tolerate a high number of ICU cases. However, as Dr. DeRosier mentioned, it's not just the ICU care that we care about, it's the admissions that don't require ICU care that diminish our ability to give non-COVID care in our hospitals. So we have a fair amount of room to work in terms of ICU beds. It's the overall capacity that threatens us.
Erica Butler with CHMA.
Oh, hi there. Thanks very much. I had a question about the chart that shows the projected decrease in hospitalizations and cases depending on contact levels. there's scenarios there for reduced contacts, for certain percentages of reduced contact. I'm wondering, what's the correlation between those percentage reductions and the further measures that we have in our toolbox? And I'm thinking of level 3 restrictions. So I guess what I'm asking is level 3 expected to cause a 10% or 20% or 30% reduction in contacts among people? What is the expectation from that winter plan, that level 3?
Yeah, no, thank you for the question. Sorry, I'm hearing some feedback there in the... Okay. So in terms of what we're expecting, I'll start by contextualizing a bit. The reduction or the proportion of reduction in contact rate is based on our current situation. So take whatever number of contacts that exist under our current level 2 measures, and you'd have to reduce an additional 10 or 20% based on the curves presented today from that. In terms of how much we expect the measures to reduce that contact rate, of course, the measures that we are putting in place or that are proposed through our level 1, 2, and 3 winter plan, aim at reducing that contact rate. How exactly it shakes down is always a bit more difficult to ascertain, but certainly things like a single household bubble down from a steady 10 would reduce that further. And that's the hope of those measures, if they need to be enacted, is to reduce that contact rate between individuals.
Thank you. Suzanne Lapointe with Global.
Hi, can everyone hear me?
Yes, thank you.
Hi, my question is for Dr. Desrosiers from Vitalité.
Okay.
So Dr. Dornan from Horizon mentioned perhaps bringing in staff from Vitalité. Do you have the staff to spare? And if so, why do you think Vitalité is faring so much better than Horizon when it comes to staffing challenges currently?
La situation est...
The situation, the answer is never going to be a unique answer because the situation changes every day. So the reality per zone, the reality by hospital is not going to be the same everywhere at the same time throughout the province. So the reason why I often quote the zones of Campbellton and Edmonton as examples, because these are the places where there's more cases to manage, and those are the places that allow us to test our pandemic plan and our strategies. And it's a pleasure for us to share the lessons that we have learned throughout the pandemic with our partners in health, of which Horizon Health Network. But now Horizon helped us at times, and we've helped Horizon at times, and in the future, and we expect to continue to act in that way according to the realities of the different zones in the province. Thank you.
Aidan Cox. Laura Brown with CTV.
Hi there. Dr. Russell, I'm wondering if we are truly waiting until there's 100 people in hospital with COVID-19 to move to level 3, or if you are actually considering moving to level 3 sooner than that, despite not potentially getting to that trigger point.
Hi, Laura. You know, we would like to avoid having to go to level 3, and it's the other part of this briefing today is really around what can the population of New Brunswick do right now collectively and individually to protect the healthcare system to avoid having us go to level 3. So it's, and as I mentioned before, our triggers haven't changed. The triggers are about having the risk assessment being done. We're following the situation extremely closely, and we will continue to do so.
Timothy Jakes with the Tribune.
Yes, my question, I guess, would be for Dr. Russell. It's about masks. Given their effectiveness in limiting the spread of viruses, do you think N95 or KN95 masks should be made available to everyone and or it be mandated that employees be supplied with them by employers in public-facing jobs where employees may be facing dozens, maybe hundreds of people a day, like, say, a grocery store. I think you just said they're the best form of mask, and I think you're wearing one right now. I think so. This level of protection is currently available to those who can afford it. So would it not help prevent spread if they were made more widely available to the general public, say for free, like the rapid tests previously were?
Great question. Again, we can only recommend what we know in terms of evidence-based information, and we are not saying that exclusively a person who's not in the healthcare system should wear an N95. And again, there's different types of N95. So there's the fitted ones, which again are very specifically used in the healthcare settings where there is risk. Then there's the unfitted N95, which is similar to a KN95. And if you look at the data on that, it's really the equivalent of a surgical level 1 mask. And so the surgical level 1 mask is the one that Dr. Dornan's wearing today. So they're interchangeable with the KN95 if it's fitted properly. And if a person wants to continue to wear a fabric mask, they can put a filter in it if they want. Those are available as well. So it's about having options, and it's about having the right protection based on risk.
Thank you, Mr. Jakes. Merci beaucoup tout le monde. Voilà la...
Thank you, everyone. That's the end of our update.
Thank you.